I'm Dr. Uma Ramesh in the infertility field for the past 20 years. I've been working in Pearl Singapore Fertility Center and have been treating patients who come to me for the past 20 years. So the most important problem now is fertility, which is actually on the increasing trend, and 1 in 5 couples have this problem. And infertility is such a common thing that the patient need not be actually scared or ashamed to come and meet a doctor. When and where should they meet? If the patient is young, just married for a year or so, they can just come for a counseling, or they can just meet a doctor and do the local test. But if the same couple is about 30 years, they may need a treatment because age increases, the fertility levels go down. So the most frequent questions the patients who come to me ask is, we have been trying for a fertility for so and so months, will I be able to conceive? The next is, once the investigations are done, what kind of treatment will I undergo? And nowadays people are all working, so they need to know the time frame, they need to take leave, the cost involved and the cost effectiveness, and the future, they want to know about the future of the child, how the child will be, whether there will be any disability in the child conceived through the treatment, and moreover they want to keep it a secret so that the patients or they feel that the community should not know they had a child through the treatment. So we'll go through one by one. Like the treatment which the patients undergo may range from a smaller treatment to a bigger treatment depending upon the investigations. The fault may be with the female or the fault may be with the male, which is about 50-50%. And the treatment mode is very simple, and the investigation mode also is very simple. For a male infertility, they need only a checkup for the sperm. A simple semen test done at the proper time in the proper lab will tell us whether the sample is good. For a female, they have to undergo 2-3 tests, like they have to see whether the uterus is fine, whether they are regularly ovulating, and whether the tubes are open. So the treatment will depend upon where the problem is. Suppose you are able to identify a problem, the treatment will depend upon those tests. Say suppose your tubes are blocked, there is no way the tubes can be cleared easily. Very rarely it can be cleared by hysteroscopy. But if the tube seems to be blocked, they need to go for a higher treatment, say for IVF. Suppose the ovaries are not functioning well but the tubes are good, what they need is a simple ovulation induction. This is that we give medicines for the ovaries to produce egg and then ask them to have natural intercourse. And if the uterus has some say solid masses like fibroids or polyps, they may need to have been removed before they undergo treatment. So the treatment strategy will depend upon the patient's condition. Success rate depends upon again the investigations. If there is a clear cut things like if the tubes are blocked, the success rates are more. But if there is a male infertility, it depends upon the fertilization capacity and the morphology of the sperm that will determine their success rate. Coming to IVF, most of them end in IVF and say about 5-10%, and there's a lot of money involved, there's a lot of time they have to take away from their home and the office, so they have to plan ahead, and that is when they ask about the results. The results are tailor-made. It has to be depending upon a patient to patient, and normally the world around it's about 35-40%. And if the patients fall into the category where there is an unexplained infertility, the results will be known only when the eggs are being collected and fertilization is checked. And the other thing is, when they go for a higher treatment, they ask whether they need to get admitted in the hospital, whether they need to take long leave. It's absolutely not necessary. IVF is also a day care procedures, and after fertilization and after the pregnancy test is positive, they need to be on medications for a few months, say about 1 or 2 months, and after that they are like any other pregnant lady. And as far as the baby's problems concerned with after IVF, it is actually same as that of a natural pregnancy. The birth and the birth also depends upon whether they can deliver vaginally or cesarean. That is again another question asked. If everything is conducive for a vaginal normal delivery, they will have a vaginal normal delivery. Only when they have twins or any other problem related to obstetrics, they go in for a cesarean. It is not a must they all have to have an operative surgeries for delivery. And after the child is born, again the question comes is, will my child behave like a normal child? Yes, your child will behave like a normal child unless there is a problem which can be detected in the pregnancy itself, which is equivalent to that of the normal pregnancy conceived. Then now the last question has come, whether I will be able to be pregnant. There are so many treatment modalities available, and there are so many places where you can go because the facilities are available in most of the places. And I am sure if you are very encouraged to come to a treatment, you will also be getting the 2 pink lines, which you will be happy to see at the earliest.